Now you're very welcome back to What Matters Part 2 with my guest today, Sarah Beasley, Pt2 Limerick. Sarah, the situation is that 5,000 beds, as we discussed, is needed immediately. The Minister, the Taoiseach I should say, the present Taoiseach Leo Varadkar, made a statement a few days ago, 2 days ago in fact, and said that the best solution was pay more money to the existing staff over time, which was immediately repudiated by a top consultant who said the Taoiseach, with the greatest of respect, hasn't a clue of what he's talking about. Now, when you hear statements like that, does it send the fear of God in you that these people are supposed to be running the country?
Oh, it does. It really does. I mean, if they get the healthcare system right, it can be very, very good. Like I was out at Crewe Hospital today, a small community hospital, absolutely fantastic. I got seen with an appointment. I had an x-ray within half an hour, and within 10 minutes of the x-ray was sitting with my consultant. And that's how it should be.
Yes.
And the staff out there, they're under pressure, but it's nowhere near as when you go out to A&E.
Yes.
Like I go out once a month with my father to the regional hospital.
Yes.
And it's utter chaos. Now, we don't go near the A&E, thank God, in a long time, but just even going in for a clinical appointment, it's just under pressure, and you never get to see the same consultant.
Yes.
So you're wondering what care, because I'm having to tell them what's wrong with my dad,
Yes.
and they're flicking through files and they don't know where he's been for this appointment
Yes.
or that appointment. That's not working. So
Yes.
they need to get it like a smaller hospital, like Crewe, or what's happening in here. If anyone's sick in this city, any elderly person, all they want to do is get out of the regional and get into St John's. This hospital is fantastic, fantastic staff, as is the regional, but the two under pressure, and then to actually ask them to work overtime, this is going to, completely mess with their mental and physical health. The medical staff cannot do that.
But you see, that already is happening, because there was a wife of a consultant on air saying that the Minister needs to cop on and the HSE, because the men and women involved in the medical service are so burned out, they're actually leaving.
Yeah.
They can't go on.
Yeah.
So this is a terrible indictment. So with the billions, and this is really ironic, and this really made me fume this morning, and you know me, Sarah, I say what I mean, and like you. But when I saw the Minister for Finance and the Minister for Public Expenditure at a meeting announcing the big hoo-ha of exchequer surplus, billions and billions, and they're having a great laugh and a smug laugh, and looking at those two people, overpaid ministers, smug as a bug,
Yeah.
on a chair, and people literally on their knees down in Cork Hospital, University. A woman on today with Katie Hannon, 57 hours she was with a clot in her lung. That woman could have passed away. Look what happened to the young girl with regards to meningitis. We all have the examples.
Yeah.
And the great men and women that run these services are burned out. Yet we have the bureaucrats in the government, and we have the bureaucrats in the HSE, and they haven't a clue how to deal with people.
The smugness will fade away, I can tell you that, because people are angry. You can see it all over social media. Every single comment is in relation to the trolley crisis, and everyone has a story, a horror story to tell about a family member.
Yes.
And like you say, young people dying, to those parents that had to bury a child
Oh,
so
dear
young,
God, yes.
when it was so unnecessary. All it was, if they got the antibiotics into us sooner. But look, it's awful to talk about a case that is obviously so raw with their family. But me having elderly parents, it's the dread that they get sick. And in
Of
Limerick,
course.
the only place you can go whether you've got private healthcare, public healthcare, is in to what people now describe
Yes.
as hell on earth.
Why, in the name of God? And Sarah, you have your fingers on the button, as it were, being Pt2's representative in Limerick. Why did they actually decide to close certain A&Es, Nina and Dennis, and
Yeah.
shoved them into Limerick.
There was a report back in 2009 and how they were going to make this service for excellence out at UHL. How did that work out? And back in that report that is somewhere hidden, there's actually the description of how many beds, it hasn't happened.
Yes.
So there's actually less beds out in the community at the moment than there was in 2009. And then AIM 2 was a parliamentary question in relation to people that can't actually get out of the hospital. They don't have anywhere to go, so they're keeping a bed that someone else could have because there's no aftercare in the community. There's the lack of care facilities, there's a lack
Yes.
of home care, and that's the issue as well. So it's far greater than what's happening in the hospital.
Yes.
It's the fact that outside the carers are there for elderly people or vulnerable people or people
Yes.
with disabilities to actually go home, because they don't have the community services within that.
Okay, I'll come back to you with part 3. Join us very shortly.